Okay. Good afternoon, everyone. I am Alan Daniel F. Abusejo, your Masters of Ceremony for this webinar. Before anything else, we would like to ask everyone to please observe proper etiquette, and for those who have not joined yet, may we ask them to join us with the provided link in the chat box of each section. Now, to formally start the event, may we call on Joji M. Flavia for the invocation to be followed by the national anthem and the Liceo hymn.
Let us prepare our minds and hearts as we acknowledge the presence of our God. Eternal and most gracious Father, we glorify and thank you for bringing us another day full of hope, joy, and peace. As we gather here in this meeting, we are grateful for the person that you have used to share his knowledge today. Guide him, Lord, as he speaks. We also thank you for the team that made this session possible. For these and all other mercies, we are thankful. Please forgive us our trespasses, as we forgive those who sinned against us. Grant us your Holy Spirit to give us wisdom in understanding the topic to be discussed and enlighten our minds to fully grasp the new learnings. May this webinar bring success and growth to the learners as they continue to pursue their aspirations in life. Almighty One, let the discussion here bear fruit in our lives and in other people. May the matters that will be discussed serve as a catalyst to move us forward and cause us to advance in all areas of our lives. Pour out your abundant grace to encourage our hearts to find strength during these tough times. In humility, this we pray in your most precious name. Amen.
Voices proud and sweet, we all in this day only congregate. Through thick and thin we will, nothing will go. To all above, the banner waving to the stars of all the years, in loyal be. In every land and shining city, God is the only congregate. To thee we pledge to glorify your noble name, to chant with all our might, to make eternal praises to your name. Oh, alma mater, dear old name, glorify your noble name. To the chant with all our might and main, eternal praises to your name. Oh, Alma Mater, dear obey. We march together hand in hand. We sing together at your call. We stand the Son of Man.
Good afternoon again, my fellow classmates and our distinguished speaker. I hope you are excited as I am, together with the core members of this webinar and our distinguished speaker as we engage in this new topic of our webinar. Now, to commence formally this program, may we give her our full attention and a warm welcome as we call on Miss Andrea Ella Masconiana to give her opening remarks. A round of applause, please.
Fellow student nurses, I would like to formally welcome you all to the 3rd of March 2021 Arterial Blood Gas Webinar. We deeply express our gratitude for your time and attendance of the Arterial Blood Gas Webinar. I would also like to acknowledge the dedication and hard work of our talented committee, volunteers, A, and team. I can assure you, today's webinar will be informative and memorable that will not only provide you information regarding the topic, but will make you eager to learn more. Before we commence the program, I would like to share just a few key tips to make the most of your experience. The program will flow in the following: prayer and singing of the Pambansang Awit, opening remarks, introduction of the speaker, first session, break or intermission, second session, Q&A, presentation of certificate to the speaker, and closing remarks. Thank you again for making time in your busy schedule to attend this program. I am certain you will be glad you did. The program is now officially open.
Thank you, Ms. Ella, for opening our program. Now, to formally introduce our speaker, may we call on Ms. Abigail Sirania. A round of applause, please.
Once again, good afternoon, everyone. Our speaker for today is a registered nurse, born in Iligan City, Lanao del Norte, and has been a consistent honor student since primary and secondary school. Through this, it made him qualified for a scholarship in college, which was sponsored by the Developmental Bank of the Philippines, also known as DBP. At 2008, he became one of the 112 Scholar ng Bayan granted by former President Gloria Macapagal Arroyo herself. After 4 years of hard work, he finished college with flying colors, attaining a grade point average of 1.76 and passed the local boards with a competitive score, achieving the 13th spot among the 27,823 passers. With these feats, he was able to secure a solid position as a medical surgical ward nurse at Dr. Uy Hospital Incorporated at 2012. He became a trained intravenous therapist, phlebotomist, and advanced life support provider during his tenure in the said hospital. 2 years later, he was promoted as an emergency room intensive care unit nurse. With his interest in advancing his skills, he went to Polymedic Medical Plaza to train as a dialysis nurse. This is when he discovered his unwavering love for teaching, which led him to pursue postgraduate education so he can have the primary requirement for teaching a university. At 2015, he started working as a second language, English as a second language teacher at 51 Talk English Limited. He has been recognized as the most outstanding new teacher after 3 months of hard work. On March 2019, he finally accomplished his master's degree in nursing and then was hired by Liceo de Cagayan University, where he specializes in medical surgical nursing, teaching the 3rd and 4th year students, and is also a research advisor. He believes that his asset as a teacher is his dedication towards his craft. He loves teaching so much that he offers most of his time making lectures and reviewing topics. Even his quizzes are products of his long hours of thinking, and he can definitely say that teaching nursing is his passion, and he would love to do this for the rest of his life. According to his teaching philosophy, teaching is his passion, and it's the one thing that he loves doing the most. Through excellence and showmanship, and he wants his feelings to resonate to his students, so they may feel the same way that he does when it comes to their careers. With hard work and perseverance and competence in performance of lessons, his students will be able to have the best learning experience by providing a positive environment filled with opportunities of development and limited amount of pressure. The students may feel love towards their subject instead of feeling the fear of failing and not learning anything. According to him, education is not just about grades, because at the end of the day, what the students have learned is the most crucial thing. That's why he stresses the importance of giving not too much workload and just enough for the students to give their 100% focus on. For him, he is not just an educator, but also a life coach. He wants his students to feel at ease with him, in and out of the classroom. During the class, he can be their big brother who guides them in learning their lessons, while outside, he can be their friend who listens and give life lessons to them. His students' dreams are the most important to him, and he hopes that he can be an instrument in achieving those. Ladies and gentlemen, please help me welcome Mr. Christian V. Villan, MAN, RN. A round of applause, please.
Okay, thank you, thank you guys. That was very warm, super warm introduction. Makaila ko sa introduction ko. Thank you so much, Abigail. Gihurot gini mo sulat, gihurot gini mo storya ako ang kuan. Gisulat na do. Okay, thank you so much, guys, for a wonderful start of the program. Okay, so this afternoon, I'm going to talk about two topics. Number one is your ABG sampling and your ABG interpretation later. And that is a form of your workshop. So since this workshop, we're going to work. You're going to work with me in doing the lecture. Okay. So first, let us start with ABG sampling. But before anything else, okay, we're going to talk about the introduction on ABG and what is it. Okay, so this is your ABG. Okay, so your ABG from the word itself, A, B, A, B, G. Okay, so guys, can you tell me what is the meaning of ABG?
Arterial blood gas.
Yes, that's correct. So your arterial blood gas. Okay, very good. So from the meaning itself, it has everything. So from AR and BL, arterial blood. So it means we are going to use blood from the arteries. Okay, blood from the arteries. Usually, good guys, when we do laboratories, when we do sampling, we always get the venous blood. It's the venous blood always. But in ABG, it's different. It's the arterial blood. That's why it's called arterial blood gas. And then we're going to get a blood from the arteries to test gases. And what are those gases? We have lots. We have different values aside from gases. Okay, the first one is the pH. Okay, so this pH, it measures acidity and basicity of the blood. Next, we have PaCO2. Okay, guys, what is PaCO2? Partial
Partial
pressure.
pressure.
Yes, partial pressure of carbon dioxide. All right. So it can be the real meaning of your PaCO2 or partial pressure of your carbon dioxide is It is a pressure. It is a pressure. It means it is an effort. It is an effort by your lungs to exhale carbon dioxide. Okay, that's why it's called partial pressure, because it is an effort. It is an effort by your lungs to exhale carbon dioxide. Okay, next one is HCO3. So what is HCO3, guys?
Bicarbonate.
Yes, this is your bicarbonate. Very good. So this bicarbonate is produced. It is produced by your kidneys. It is sent to the lungs. And to the lungs, it is sent to the blood. So this one is a test for the viscosity or the capacity of the kidneys to, the buffer capacity of the kidneys. And then we have your PaO2. So PaO2, so very same, dual siya sa imong PaCO2. It's also a partial pressure of your oxygen. So this time, if your PaCO2 is the effort of your lungs to exhale carbon dioxide, the PaO2 or partial pressure of oxygen is the effort of your lungs for gas exchange or to deliver oxygen to your blood. So from the air your lungs inhales, and then the exchange of carbon dioxide and oxygen happens in your alveoli, and then the lungs sends those oxygen or oxygenated blood, sends the oxygen to the blood. So that is PaO2. And then you have your SpO2. Do you know what is SpO2, guys? SpO2 is your oxygen saturation. Okay, oxygen saturation, or in short term, O2 sat. So, muna siya guys, katuwi itong may pulse oximeter. Si pulse oximeter, kaya mura na siya pakman. Okay, and ibutang niyo mo yung thumb. Okay, and it will detect the percentage of hemoglobin, HGB, percentage of hemoglobin in your blood. Okay, or the oxygen carrying cell in your blood. So muna siya guys. So this is it. So the entirety of the meaning of your arterial blood gas is to get blood from your arteries to examine gases. These things. So muna na siya. And then, what is the purpose? Okay, the purpose of your ABG. So the purpose of your ABG is, number one, measures the amount of oxygen and carbon dioxide in your body. How? By these things. Kani, your partial pressure of oxygen, and your partial pressure of carbon dioxide. That's the first purpose. Second, the capacity or the ability of your lungs to deliver O2 to your blood, and the capacity of your lungs, to deliver, to exhale carbon dioxide. Okay, to exhale carbon dioxide. Okay, and the third purpose, acid base balance. Okay, so acid base balance. How? Bicarbonate, PaCO2, or partial pressure of carbon dioxide, and pH. So that's it. So those are the things that you need to remember when it comes to arterial blood gas. Now, who can perform? Okay, so who can perform arterial blood gas? So kindly guess, guys, kinsa may maka-perform sa atong ABG sampling? Yes, can you repeat? Yes, that is correct. Yes. So actually, the main people good are the health workers. But dili na masingkin sa health workers. It should be proficient healthcare workers that were trained to do ABG. One of those people is your physician. Yes. So ang physician, murag mo ni silang pinakagrabe na practitioners Ginapraktisan ginatanan basic skills when it comes to handling handling patients, handling laboratories, handling basta it's like a everything in general when it comes to medicine. The physician does it. That's why they are so qualified to do the ABG sampling. Another one, ang mga maayo mo kuha og blood samples, kinsa man ni sila?
Med.
Very good. Our medical technologists or the medtechs. Kani sila guys, they do two things. Number one, they get samples, and the next one, they analyze samples. That's it. And they are very good at these things. They are the best people that you can see to get samples and to analyze lab results. They're very good at this. And also, can we do ABG sampling?
Yes. If ma-train, sir.
Yes, that is correct. If we are trained. Okay, so if you are trained, guys, kaya naman guys, your ABG sampling is not being taught. It's not being taught to you in your RETDEMS. It is not. But once you become RNs, you get a phlebotomy training or basic or advanced phlebotomy training, and then you pass the training, you will have a license in phlebotomy. So that's it. Now, you are now a trained nurse, or as you're now called nurse phlebotomist. So it depends. There's a course that just says 2 days. There's also a 1 week course in phlebotomy. Pero pag-RN mo. So ana. So this is one of the courses that was give or the trainings or the program that was offered to me in my first hospital because I'm one of their um, good performing trainees. And then at that time, guys, they were short-handed of medtechs in the laboratory. So the hospital is 80 capacity. An 80 capacity hospital, it needs at least 3 medtechs in AM shift and at least 2 medtechs in PM shift and 1 medtech in night shift or at night. So ana dapat. And then katuwa time guys, ang nabilin guys, duha ra gyud ka buok. Dili sila ka shifting kay duha ra gyud sila ka buok. So what they do is they trained nurses. Dili ang old nurses, the newer nurses. So I was one of the lucky ones who were included in the training. So what did we do in our training? We trained of venipuncture. Okay, what is your venipuncture? So muna kong ingon ganiha guys. Now you get blood sample from a vein or this is your venous sampling. Okay, this is your venous sampling, venipuncture. And also, what other ways did we do? What other things did we do? We also did kanang storage of samples. Okay, after mo good guys, napasay mong syringe ang blood sample, you don't test that already. You don't test that after. Di na siya i-test dito. So it will be put in test tubes. And we also learned the different colors of test tubes with different tests that are going to be performed with them. So murag markers na sila nga. Mo na sila, example sa imong CBC, complete blood count. Mo ni siya nga, diri mo siya sa EDTA ibutang, sa violet nga color sa kwan imong test tube. And then pag kwan siya, kana bitong sana chemistry, so blood chemistry. Pag blood chem pod mo na imong mga kanang imong blood chem na adira ang cholesterol, triglycerides, blood sugar, so na adira. Pwede na siya ibutang sa red or pwede ibutang sa yellow. So ana. And then your ABG it's being put in a green test tube. Ganong color man ni sila. Namo ko sila yung mga corresponding preservatives nga ginabutang. Okay, so it depends. And then your blood samples, napo na sila yung mga time na kano saan na sila valid na pwede ka mag-test sa ilaha. So na sila yung mga time, guys. So that's why there are different preservatives with a different purpose in laboratories and different colors. So muna ang gituin sa mga. And then the last thing that they trained us is your ABG sampling. Your ABG sampling is a hard one because it's not like your regular sampling nga kanang nakanangkuan lang ka sa imong venipuncture it's easy because veins, you can feel veins. Pareha ni guys. Kani siya ang the best area sa imong kuan venipuncture. Try mo diri guys, nakaanay mo kamot din. Pag feel mo diri aning ugat nga tambok diri nga part, i-feel na ninyo. But usually pag magpa-blood test mo, magpaat mo tumog laboratory, ang ginatusok nila kani, ano man, naamo gud diri mong dako nga vein. So mo ni siyang the best area nga kuhaan kag sample. Pag hikap nimo ana, labo na katong magkuhan, labo na katong mag-weightlifting, mas mo prominent ni siya, mas maklaro ni siya diri nga vein. So pag hikap nimo tambok na siya. Mo nang ginatusok sa imuhang venipuncture. Tusok venipuncture ana dapita. Tusok. Kuha example. So ana na siya. But your ABG is different because your arteries, it cannot be seen, it cannot be felt. But there's a clue. There's a clue kung unsa o kung asa atong arteries o atong area for arterial sampling. Can you guess what are those? Tudug, tudug, tudug. Unsa man na siya?
Radial artery, sir.
Yes, okay, that's correct. That's the radial artery. So ano ba kay balungan mo na siyang radial artery?
Pulse.
That's correct. It's the pulse. So mo ni siya. Mo rin siya atong indicator kung asa ato ang artery, the pulses. Because your arteries, that's where the pulses come from. Kay mo mong arteries guys, it pushes blood. Pushes blood. Your veins, the blood returning, the veins will get and then delivered back to the heart. Imong arteries, blood, oxygenated blood from the heart that will be delivered all throughout your body. That's why your arteries, they push blood. And pag hikapo nimo sila, you can feel the pulse because they push. They have pressure. So that's it. So that's why ang indicator lang sa imuhang arterial puncture or sa imong arterial sampling is your pulse. That's why it's hard. Kaya nga naman, you don't know where the pulse is. You just feel it. Makayong ka nga, naa diri, pero naa dito diri. Mag-iyon po ka nga, naa diri, wala, naa dito diri. So, ana gid siya. So, it's like you're really just feeling the pulse. Sa venipuncture, you can see it. Pag tusok ni mo backflow din ang blood and then you can get the sample layon. But in arterial sampling, it's different. That's why you need to be trained. So, ana siya. Okay, so here's an example on how to get an ABG sample. Okay guys, can you play the video that I provided you earlier?
Hi there, my name's Andrew. I'm one of the final year medical students. Could I just check your name and date of birth, please?
Sure, it's James Alexander, 13th of December 1989.
Nice to meet you, James. Today I've been asked to do a procedure called an arterial blood gas. This involves taking some blood from the artery in the wrist. I'm going to use some local anaesthetic, so it shouldn't be painful, but it might be a bit uncomfortable. Is that okay?
That sounds fine.
Can I just check before we begin? Have you ever been told you have problems with your circulation?
No.
Okay. Do you take any blood thinners, such as warfarin?
No, I don't think.
Okay. And have you ever been told that you have problems with clotting?
No.
Brilliant. Can I also check, James, do you have any allergies at all?
No, I don't.
Brilliant. I'll just gather my equipment. James, I'm just going to do a quick test to assess the blood supply to your hand. Could you just make a very tight fist for me? And hold it there. I'm now going to press on each side of the wrist. Keep your fist as it is. And relax. James, that's the end of the procedure. Thank you very much.
Okay, and that's it. So that is your ABG sampling. So guys, in the video, they do this kind of thing. You clench your fist and then they cover these things. What is that test called?
Modified Allen test, sir.
That is correct. That is your Allen's test. Yes, that's correct. Okay, so yes, that is your Allen's test. What is the purpose of your Allen's test? So your Allen's test is it's a basic indicator that your artery is perfect, or your inner artery is perfect for ABG sampling. It also measures collateral circulation, because this is what happens. Your artery here will be punctured. Boom. Okay, your artery will be punctured here. So as a damaged artery, because it was punctured, the function of this artery will be impaired for the meantime, or probably it won't be 100% in the meantime. So your Allen's test will help check the functioning of your ulnar artery. If it is enough to provide circulation to the rest of your upper extremity. Kay na punctured man siya, na damaged man siya, ma-impaired yung functioning. Para ma-make, then kailangan siya back up. Ang backup niya, ang ulnar artery. So if enough ang ulnar artery makaprovide the circulation sa rest of the upper extremity, it means you're good to go. So that's it. So ano na siya guys, it's just finding a backup ang imong renal artery. Kaya ma-impaired mo siya. Muna nakita ito na ganyan guys. Usually anar am gina siya. Clench your fist, probably mga 10 seconds, and then open your fist. Pag open sa yung fist, i-release din mo ang ulnar artery. Mabalik din na siya pula na yun. So anara na siya. Actually, di man ako siya mabuhat og duha ka mo, so gisara na ako. Pero pag proper kayo, it's two hands good siya. And then you're going to release this one, this part right here. Imo dyan mong gi-impair ang imuhang renal artery. So ana guys, that's your Allen's test. The capacity of your ulnar artery to become back up in providing circulation to the rest of your upper extremity or your hand. So muna to siya guys, the Allen's test. And the most important thing in your ABG, you can't see it, you just feel it. It's where the pulse is. Muto na guys, when he punctured, he was holding or was feeling the pulse. Kung asa tong pulse, kusog, it's the best it's possible that the artery is there. And then the angle, it's 45. Unsa gani nga kuan? Unsa gani nga kuan gani angle in injecting? Si pangalan na niya?
Sub-Q, sir.
Very good. So it's like your sub-Q puncture, sub-Q injection. This is your unsa gani? Very good. I am intramuscular. Kani sub-Q, subcutaneous. It's the fats. Muscle man ang pinakalalom, ang sunod niya ang fats, and then ang pinakamabaw, the skin or the ID, intradermal. So ana guys, remember it's your sub-Q. Di mo siya ma-90. Kaya ano man, naaman imong kamot nag-feel sa pulse 90. Imong pulse na adiri, nindira ka o wala kay naigo, nagpasakit lang ka. So kung ana gid dapat hiwi gid siya. Kay para na adiri ang pulse, matusok gid siya. Paglalom na igo gid siya. Pag intradermal pod, was. Pag intradermal nimo, imurang kamot imong giigo. So ana guys, that's how you do ABG sampling. And when the rules of ABG sampling as follows: when you puncture, you wait. So kana sa imong syringe guys, na siya murag lingin diri, kana murag chamber diri. Pag mo backflow na gani ang blood dira, it means you hit already the blood vessel. Either veins, either artery, pag mo backflow na ng blood, it's okay. Makita, maka pull na din kasi mong kuan, plunger, para makuha niyo ang blood sample. Ang imo lang ABG, lisod gid siya. Painful siya sa imong patient, kaya naman, pag dili ka sharpshooter, pagtusok nimo, mag-atras abante ka, maana din mo siya. That's why guys, atong ABG guys, ginabuhat na to ni pag atong patient nasa ICU. Kaya naman, your patient it's like in a coma, vegetative state, tulog sila, ana, balag, eksperimentuhan mo na kayong pasyente dira, they won't feel anything because they're asleep. So ana, pero nauban ko na sa ICU nga mata gyapon mag-ABG gyapon na sila because ABG is very important. It's one of the deciding factors of the doctor on how to proceed with the treatment of the patient nga nasa ICU. Whether they give up, whether they isa ang ABG nga maka-decide ang doctors nga i-give up ang nilang pasyente o dili. So that's one of the reasons. Why? Because it tests the capacity of your lungs. Kung maka-eject pa ba siya O2 o CO2 o makapasulot pa ba siya O2. So it's one of the reasons that your doctor will say, I give up. And it's one of the reasons where your doctor will say, we can still fight. So ana na siya. That's how important ABG is. So sa ICU, we do that a lot. Dagan naman siya buhaton. Kung wala ang residents on duty, siyempre physician man, kung wala ang residents on duty, medtech yun. It's always the medtech. Pero since busy ang medtech, we wait for the physician. Pag wala ang physician, daghan pag-atiman, the ICU nurse will do it as long as the ICU nurse is trained to do it. So ana. Okay. And then when after you get the blood sample in sa gawas, kato siya UK man siya. Katong video, that's an OSCE review. You take OSCE exam if you want to go to the UK. So after you graduate, if you want to go to the UK, you take IELTS, an English proficiency test, and then you take OSCE. After you take OSCE, you become UK nurse. That's why katong video ganiya, it's the best resource. Mo to siya legit na resource. So and then after nimo pagtusok sa patient, makuha na ka sample, di ba sa ila tangtang ang needle. Imo na siyang tabunan natong kwan, taklob sa test tubes. Mo to ang taklob sa test tubes kay kita mo ang color niya kay green. Inato po ang taklob sa test tube kung asa to siya ibutang. So green. So kung kitabon siya ito, it's already green. So murag ang syringe nahimo na siyang test tube. So ana sa ila guys, nga naman, wa mo recap sa ila ha. Sa to din Philippines, wa tayo na pagtusok sa imong syringe na 3cc syringe, pagtusok pag ana recap juga. recap juga pero single swipe. Ana para safe. So ana man atong rule na rin para dito mo tusukan. What if your patient has hepatitis? Tusukan nimo pag recap nimo. So delikado siya. That's why sa gawas, they prevent that from happening by kuan gid kanang kung mo tusok nato sila automatic na taklob, iana lang nimo. So di na ka mag-ana, ana lang nimo, tinangtangon nimo. Butang din nimo tong kuan din, taklob sa test tube. So ana ra siya. Ana ra siya kadali sa gawas. Hopefully ina na para to dari para mas safe. Sumoto. And then, before you remove, naman siya kay butang nga dry cotton. Kanimong dry cotton, pag magtusok ka, di mo na siya ikuan, namo kay uban, na uban medtech, na uban lab nurses, ilang ipatong sa wound na mag-remove pa. So ilang ipatong mag-put sila pressure and then ga-remove sila ka ng needle, so sakit na siya. What you do is you wait. Remove, wait, and then boom, pag-remove na, you put. So ana dapat dili dapat babag na kadra then ga remove pa sakit mo na siya, it's sakit gi pressure nimong needle sa sulod. So you wait and then you pull and then butang. Same with venipuncture. So ana ang basic na kuan na niya. And then the difference between one of the differences in your arterial sampling in your venous sampling. Pag imong venous sampling, you put tourniquet. So magbutang siya kag tourniquet sa imong venous sampling. Ana sa imuhang kwan guys, sa venous magud hinay ang kwan sa blood, hinay ang pressure sa blood. Nga naman receiver man ang veins, receiver of blood. Ang imong artery is the pusher of blood. Pusher sa drug addict, pusher of blood. Kusog siya pressure. That's why pag bukuha kag ABG, no need for tourniquet. Hindi na mo siya ibato tourniquet. Katugan niya wala na. Gagunit ra siya sa pulse, nag-get check sample with no tourniquet. So ana ra siya kadali. Nga naman your arteries are pushers. There's pushers. They push your blood. Nasa force. Hindi na kalagwan. And then, another one, the difference of your... Is there pa ba? Okay, wala na. So, mura to. Mura to siyang difference. The arteries and your veins. And that's it with your ABG sampling. So, ato siya kadali. Guys, nice guys. Interested ba mo maka-learn og ABG sampling? Puhon, pag-graduate ninyo?
Yes, sir.
Yes, sir.
Yes, ana
sir.
good. Ana good. Yes.
Procedure.
Whatever. Yes, ana good guys. Whatever unsay available nga training pag RN na ninyo, any available nga training, you join. You dapat all-rounded nurse. Kanang all-rounded nurse, muna sila kanang muna sila kanang in demand. If you're all-rounded, mas taas ang tsansa na madawat ka sa the best hospitals because they know you are skillful. Kani mo guys, pag graduate mo guys, pag RN na mo mo, panaghanay na tag ID ana. Ako sa una guys, bago kong graduate guys, RN ko na ako'y license. Afterwards, nag-train ko IV training. So, kuan ako, IV nurse na ko. Pwede na ako magpatakag to sa textos mag-iasa. And then, nag-train ako basic life support sa Red Cross. Fum, na po ko idea na. Nag-train na po ko advanced life support. Ibalo na ko mo-intubate. Tusok, ana. Ana po ko idea na. Nagkatong gitrain ko phlebotomist after 3 months. Napaga mo ko idea na. Panaghanan na kita idea na guys. Inana na siya guys pag RN nyo guys. Daghanay mo ID. Kaya kada niyo training, get ID, training, get ID. Ana na siya. Pasikatay tag idea na. So, every available training pag RN niyo, grab. Why? It advances your skills. So, ana. Nagkanagay mo ID na yun. Hilas na yung ID na guys. So, ana na siya. Kung kiso ito pinaka-ID mo, ito pinakaayos. So, it is also one way for you to be recommended guys if you are very skillful. So, and the proof of that one are your trainings. All right, so that's it for your ABG sampling. We are going to have a break, and then later we're going to talk about ABG interpretation.
Thank you for that wonderful discussion for the first part of the ABG webinar, sir. Indeed, we have learned a lot throughout, and we will soon expect ourselves to be learning and be training ourselves to become or to specialize in ABG tests. Now, to serenade us with her beautiful voice, may we call on Colleen Ceballos for her intermission number. A round of applause, please.
Di mo lang alam, naiisip kita. Baka sakali lang maisip mo ako. Di mo lang alam, hanggang sa gabi inaasa makita ka muli. Natapos ang lahat sa di inaasahan panahon, at ngayon ako'y iyong iniwan. Luhaan, sugat at di mapakinabangan. Sana nagtanong ka lang kung di mo lang alam. Sana'y nagtanong ka lang kung di mo lang alam. Ako yung nasaktan. Baka sakali lang maisip mo naman. Hindi mo lang alam kay tagal na panahon. Ako'y nandito pa rin hanggang ngayon para sa'yo. Lumipas man ang araw na ubod ng saya. Di pa rin nagbabago ang aking pagsinta. Kung ako'y nagkasala, patawad na sana. Puso kong pagal ngayon ang mahal. Oh, 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 di mo lang alam, ako yung nasaktan. O baka sakali lang maisip mo naman, puro sana lang. Sana ako naman di mo lang alam, kay minamasdan. Sana yung mamalayan, hindi mo lang pala alam, di mo lang alam. Kahit tayo'y magkaibigan lang, bumabalik lahat sa tuwing nakukulitan. Baka sakali lang naman. Ako'y nandito lang, hindi mo lang alam. Matalino ka naman kung ikaw at ako ay tunay na bigo. Sa laro na ito ay dapat kang sumuko. Sana hindi ka na lang pala aking nakilala. Kung alam ko lang, ako yung masasaktan ng ganito. Sana nakinig na lang ako sa nanay ko. Di mo lang alam ako yung nasaktan ng baga. Sakali lang maisip mo naman, puro siya na lang. Sana ako naman di mo lang alam, dahil minamasdan. Sana yung mamalaya, hindi mo lang pala alam. Oh, malas mo, ikaw ang natipuan ko. Di mo lang alam, ako yung nasaktan.
Thank you so much, Colleen, for serenading us with your beautiful voice. So it just shows that we as student nurses are very much talented and we have a lot to offer, not only in our field, of course, but also in extracurricular activities. So, abigyan na wish ba pero dili di ay. So let's just all like, share, comment, and subscribe. Support our fellow SN. So now, let us continue with the second part of our discussion with our ABG, which is the workshop, together with our very own Sir Christian Villan. A round of applause, please.
Thank you, guys. All right, so sakto, same here, Alan. So I thought wish bus. So one question for Colleen. Colleen, unsa may dili nimo mabuhat? Ito, kabis ko ni talented kay guys. Okay, so all right, so here earlier we talked about sampling. This time we're going to talk about interpretation because one of the things, one of your purpose of your ABG is your acid-base balance and then the capacity of your lungs. So, kwan gid siya. So that's why we need to have our ABG interpretation. Okay, so this ABG interpretation is just like a game. It's just like a game of tic-tac-toe. Pero di yan akong technique, guys. I have, in order for us to do something accurately and properly, we must really master the basics. We must master the concept. Namong techniques, guys. There are lots of techniques in which it forces you to memorize stuff. When you memorize stuff, there's a big chance that you will forget them. You may memorize them today, tomorrow, next week, but next month you already forget that one. But as long as you master the basics, as long as you know how to do this thing, how this thing works, o pilit na siya sa imo, you just recall it. Ma-recall na nimo pagbasa nimo ana nga term. So ana, guys. Okay, so here. Okay, this is your ABG interpretation. Okay, so first things first, we must know the normal values. So earlier, we had 5 types of results that we must know. Katong naato siyang SpO2, our O2 sat or oxygen saturation, naapo tong PaO2, partial pressure of oxygenation or R oxygen. Dili guys, sa atong ABG interpretation, we just need to know 3. That's the pH, the PaCO2, or akong tawag na kay pakutura. So the pakutu, so it is one partial pressure of carbon dioxide, and your HCO3, which is your bicarbonate. So first, we must remember, you don't memorize how to do ABG interpretation. You just memorize these 3. Kanila silang kailangan memorize. So pH, 7.35 to 7.45. So dili ra siya nga one number, there's a range. So okay, tanan normals guys, nagi na siya range. Wala tayo normal na kanang isa ra gina siya. So nagi tayo range. Kay kwan man, namogoy times ka times ka musaka, na times ka muubos. So nagi tayo range. And your PaCO2, remember, the normal is 35 to 45 mmHg. mmHg is a measurement of pressure, is a unit of pressure. That's why pag makuha kag BP, ang unit sa imong blood pressure kay mmHg japon. So, that is the normal value, 35 to 45. Walay problema guys, nga naman, tanawa ang pH. Pareho sila. 7.35 to 7.45. Same with your PaCO2. Your bicarbonate, okay, this one is a bit different. Just remember it is 22 to 26 milliequivalents per liter. Okay, mo man siya ang kadaghanon sa carbon dioxide sa imong blood. It is measured by milliequivalents per liter. Kanang liter mo ng blood, ang HCO3, ang milliequivalents, mo na siya ang solute, which is your carbon dioxide. Yes, bicarbonate. Bicarbonate day, sorry. Okay, kaya siya guys. Timani guys ha, what is the normal value of your pH? 7.35 to 7.45. Normal value of your PaCO2. Yes, 35 to 45. Normal value of your bicarbonate, 22 to 26. Very good. So now you know the normal values. Keep it in your mind and in your heart and in your soul. So ana na siya. And then, after knowing the normal values, you must know that the nature of your carbon dioxide is acid. Okay, timani guys, the nature of your carbon dioxide is acid. So timani guys, if daghan og carbon dioxide imuhang lawas, it means imong lawas acidic. Why man? The nature of your carbon dioxide is acid man. So since ang carbon dioxide acid, kung nasa sulod sa imong lawas daghan, it means acidic ka. Kung gamay siya sa imong lawas, it means basic ka. Hana. So timani ha, carbon dioxide is acidic in nature. Now your bicarbonate, your bicarbonate is being secreted, is being released by your kidneys as a buffer for the acidity. Since buffer mo siya sa acidity, he is basic in nature. So timani, your bicarbonate is basic in nature. So kung taas imong bicarbonate, basic ka. Kay base in nature man imong bicarbonate. Kung low ang bicarbonate sa imong lawas, you are acidic. Kay nga naman, wala nag-release og daghan bicarbonate sa kidney, nakulangan og buffer, acidic gyapon ka. So timani, guys, pag daghan ang carbon dioxide sa lawas, unsa ka? Acidic. Pag gamay og bicarbonate sa lawas, bicarbonate, crap. Kung daghan og carbon dioxide sa lawas, unsa? Acidic. Good. Kung gamay og carbon dioxide sa lawas, unsa man? Basic. Kay why man? Carbon dioxide is acidic in nature. Yes. So what about daghan ang bicarbonate sa lawas? Unsa man? Basic. Correct. Kung gamay ang bicarbonate sa lawas, acidic. Kaya nga naman, bicarbonate is, yes, bicarbonate is basic in nature. So ana guys ha, timani na siya guys. And also guys, we also have this pattern guys. Guys, ana guys ha. Inanay gyud timanan guys. Ato na siyang i-relate sa tong kwan, sa tuwang directly proportional o atong inversely proportional. So this is your pH. This is your PaCO2 and this is your bicarbonate. Okay, imong pH, imong pH pagtaas. So okay guys, pagtaas ang pH, basic, very good. So that's basic guys. Basic o pagtaas ang kwan pH. Pag mubo ang pH, acidic. Very good. So mo siya pinaka-basic nga to timanan guys. Bata pa mo guys. Nagkuan pa mo nag-science 1 pa mo, gitudluan na mo sa pH. Pero wala mo tudluyan eh sa grade 1 mo. Karon mo tudluan. So that's why kanidaan guys, it's basic for you to know na ang pH ubos acidic. Ang basic na ang pH nga taas basic. So kani guys, kani ang imong pH ug imong PaCO2, they are inversely proportional. Inversely opposite silang duha. So unsa to guys, pag ubos ang PaCO2, Basic. Kay Wyman,
Acidic.
your PaCO2 is acidic in nature. Pagtaas ang PaCO2,
Acidic.
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 acidic. Because PaCO2 is acidic in nature. The more PaCO2, the more acid. So, ana. So, they are inversely proportional. They are opposite. But your pH is directly proportional to your HCO3. Ang meaning ana, kung ang pH nga taas, basic, ang pH nga ubos, acid. So, okay. Ang imong bicarbonate. Kung taas ang bicarbonate, unsa gani?
Basic.
Basic. Because it's basic in nature. And then pag ubos ang bicarbonate, unsa gani?
Acidic.
Acidic. Because your carbonate is basic in nature. Kung less ang bicarbonate, acidic ang lawas. Kaya kulang ang buffer nga gina-release ni kidneys. So ano siya guys? Okay? Your pH, opposite gina siya sa imong PaCO2. They are inversely proportional. Okay, this is another clue. And for you to know nga, dali ani mo identify nga, taas ang kuan kanina mo ni siya. Ubos ang kuan kanina siya. So this is one indicator. They are directly proportional, pH and bicarbonate, and inversely proportional sa pakuto. So ana guys, that's another clue. Kung saan yung pakibalo nga, taas siya o ubos, aside sa mga values. But just remember the basic agad guys. Your PaCO2 is acidic in nature, and your bicarbonate is basic in nature. Mura din siya imong dapat timanan, di na din ka mawala. Boom. So ana guys. Okay, here. So let's go back. Okay. So let's go for exercises. Okay guys, stay with me. Let's go for exercises. Okay guys, the first thing that you're going to know in interpretation is imo siyang interpret isa-isa. So let's start with pH. So kaning pH guys, unsa man ni guys? Acidic or basic?
Acid.
Yes, it's acidic. Yes, because this is below 7.35 acid. Now, imong PaCO2, 35 to 45. Unsa man ni siya?
Acidic.
Yes, taas imong PaCO2. And remember, PaCO2 is acidic in nature, so it's acid. What about your bicarbonate?
Basic.
Yes. 22 to 26, taas
Basic.
imong, yes, taas imong bicarbonate. So this one is basic because bicarbonate is basic in nature. Okay, now, after na-interpret na mo sila isa-isa, you find kung unsa ang kapareho ni pH. So C, unsay kapareho ni pH. Unsay kapareho ni pH, guys?
Pakuto.
Very good. The PaCO2, correct. And then, remember lang guys, na imong if there's a problem in your PaCO2, it is respiratory in nature. And if there's a problem with your HCO3, it's metabolic in nature. So ano na, just remember, pag PaCO2 ang pareho sa pH, respiratory ang tong problema. Pag ang bicarbonate ang pareho sa tong pH, metabolic ang atong problema. So that's it. So unsay name ni guys?
Respiratory acidosis. Partially completed.
Sige, una natin ng conversation. Ito muna sa pangalan. Okay. Kanina ta. Sige, so it's respiratory acidosis. Why man? Kay ang atong kapareho sa atong pH ang PaCO2, which is atong problema, the respiratory system or the lungs. So the lungs, guys. So it's respiratory acidosis. Next one, 7.51. Unsa man ni? Basic. 7.35 to 7.45, taas. Pagtaas, basic. What about your PaCO2? 29.
Basic.
Okay, so basic yapon 35 to 45, ubos sa 35, pag ubos ang PaCO2 na acidic in nature, ubos man. So basic. What about your bicarbonate na 19?
Same. Acidic.
Acidic. Ay 22 to 26, gamay ang 19 nga basic in nature, acidic siya. And then, ano siya yung pangalan na ni?
Respiratory acidosis.
That's correct. So, why man? Kaya ang PaCO2 yapon ang pareho sa itong pH, which is atong problema na sa respiratory system or the lungs. So, ang name ni respiratory alkalosis. Ano na siya kadali, guys. So just remember the normal values and remember that your PaCO2 is acidic in nature, your bicarbonate is basic in nature, and your pH, pag ubos, acidic, pag taas, basic. Okay, another one, last one example. 7.23.
Acid.
Sir.
Okay, so acid. Okay, that's it. So acidic siya, guys. Kaya naman, 7.35 to 7.45, ubos siya, acid. What about your PCO2?
Basic.
Basic.
Yes, 35 to 45, ubos sa 35. Okay, basic. Correct. Now, what about your 17 bicarbonate?
Acid. Acid.
Okay, so 22 to 26, since ubos sa 22, na basic in nature, acidic. So, ana ra siya, guys. What's the name of this one?
Metabolic acidosis.
Metabolic acid.
Very good. Correct. So, ang pareho ko rin sa pH, since bicarbonate man, atong problema kay metabolic in nature. Na problema sa imong kidneys sa pag-buffer niya sa iyang buffering capacity. So, problema sa kidneys, metabolic acidosis. Okay, so acidic ang imuhang lawas. So, ana guys, ana lagi siya kadali. Now, that's it. That's it for the first step of naming. The next one, let's talk about compensation. We have 3 types of compensation. Okay. And then we have techniques. Ano mo siya, guys? If there is something wrong with your kanisya nga drawing, kanisya nga sample, atong problema nasa kidneys. Since imong kidneys, hinay ang yung production o release sa bicarbonate, maningkamot si lungs o compensate. And what will lungs do? He will compensate to. Okay, he will compensate nga kuan kanang since acidic man ang lawas, mag-compensate si lungs nga magluwa pa og daghan carbon dioxide. Exhale carbon dioxide. That's why mag-hyperventilate ang pasyente. Hyperventilate ang pasyente para ma-exhale ang dagan kay carbon dioxide sa lawas. I-exhale ang dagan carbon dioxide sa lawas kay atong carbon dioxide, it's more acidic. So it's acidic man siya. Di acid na imong lawas daan. So i-exhale na ang carbon dioxide sa imong lawas. Kay daghan ra kaayo. So ana guys, luwa ana guys, kay para mo gamay. So that's why ang number 3 ni ubos na siya. Ano man, nag-compensate man siya. Kay ubos na tong PCO2 dari, compensate man siya. So ana siya guys. Okay now. And then night technique ana. You look at the numbers. So pakibalo na ka sa pangalan, you look at the numbers. Now, okay, you look at the normals. Timani, pag kwan gani, pag nothing is normal, that's partially compensated. So, timani ha, nothing is normal, partially compensated. What's the reason? Anong partially compensated naman? Kaya anim good guys, imuhang lungs may problema. Ay, kaning example, imuhang kidneys may problema. Ni compensate si lungs. So, dili sila normal. Kay imuhang bicarbonate daan, dili normal. Imong PaCO2, dili normal, kay ni compensate. So wala gyud normal. Tanaw tong pH, dili po siya normal. Kaya it means kanang wala siya na normalize mo nang partially compensated ra siya. Partially compensated ra siya, mo ganing gitawag siya nga na compensate pero partial ra. Kaya ano man wala man na normal si pH. Ang tanawon gyud nimo si pH kung na normalize ba siya. Kaya kung na normalize siya, that's fully compensated. Sa case atong partially compensated, nothing is normal. Kaya abnormal daan atong lungs or kidneys, and then ni-compensate ang isa, so abnormal pod, and then partially lang siya, kay partial ra, wala na human ang trabaho sa ga-compensate. Kaya wala na normalize ang pH, that's why walay normal. Abnormal gapon apili mong pH. Now, what about uncompensated? Pag uncompensated, either PaCO2 or HCO3 is normal. So either PaCO2 or HCO3 is normal. Nanuman, if naay problem ang imong lungs, di ba dapat mo compensate magit sa kidney. Then makita nimo nga wala ni compensate sa kidney kung normal ra siya. It means si kidney katanga ra ko. Si lungs kay nabikil, ni ubos or ni taas, then dapat si kidneys mo compensate. Ang gibot ni kidneys gatanga. So that's why normal rang value ni kidney. So sa either way pod si kidney ang na problema, mo compensate dapat si lungs. So dapat mo taas o dapat mo lihok pud imong PaCO2, mo taas or mo ubos. Pero ang problema si PaCO2 kay wala man ni-respond. So normal lagi po niya values. That's what you call uncompensated. Wala gi effort si lungs or si kidneys na compensate. Kaya kung naay effort, that's partially compensated. Kaya wala man niya sa normal. Pero what if your pH is normal? Kani nga time guys, pag imong pH is normal, that's fully compensated. Kaya ano man, na-normalize man ang pH. So ana siya guys. Kaya kung dili man-normalize ang pH, that's partially compensated. Kaya kani nga times imong fully compensated, the lungs is a problem, the kidney response compensates hangtod such time na grabe ang effort ni kidney na normalize ang pH. It means si kidney successful siyang mission, fully compensated. Likewise pod, si kidneys na problem, si lungs po compensate sa grabe nga effort ni lungs na normalize si pH. Mission success na po si lungs. That's why it's fully compensated. Okay, so timani guys, na you know the concept now, why it's partially, why it's uncompensated, why it's fully. You just need to remember, asa ang normal o wala ba normal. Okay, first, kung wala'y normal guys, unsa ang compensation?
Partially compensated.
That's it. If nothing is normal, partially compensated. If PaCO2 or HCO3 is normal,
Uncompensated.
very good. Kaya ang lungs o kidneys gatanga ra wala ga respond. That's why normal ra sila, uncompensated. What if the pH becomes normal?
Fully compensated.
Very good. So fully compensated because of the effort of your lungs or the kidneys to compensate, na normalize ang pH, and then it's fully compensated now. Now, the problem here, there's another problem sa atuang fully compensated. How will you know kung acidic siya or basic siya na normal man siya? So na-normalize ang pH, sir. It means fully, makaname na ta diretso nga fully compensated siya. Pero ano ito pakibalo siyang name? Kung acidosis pa siya or alkalosis, there is a range. That's why there's a range. Look at your range, 7.35 to 7.45. So, kibalo man ta nga pag ang pH kay ubos, that's acidic. Ang kibalo po ta nga ang pH pagtaas, that's basic. Now, since normal na itong pH, you look at the range. Kung ang imuhang range nasa 7.35 to 7.39, kaya wala man tayo pH ka 7.4, 7, average lang man na. So, mutanaw gani ka pag 7.35 to 7.39, naana siya sa range sa paubos. Since paubos man, it's acidic. Pag imo pong pH is 7.41 to 7.45, asa man na siya nga range? Naa siya sa pataas. So, kana siya basic. Gets so guys?
Yes, sir. Yes, sir.
That's it. Okay, very good. So, timani guys, ang pH 7.35 to 7.45, that's fully compensated. So, if ang range nasa 7.35 to 7.49, paubos na siya, that's the lower limit. That's the lower limit. And pag kibaluta, pag low, acidic. And then your 7.41 to 7.45, that's in the upper limit. And pag up, kibaluta, pag taas, basic. So, timani guys. Okay guys, let's do some exercises. Okay guys, look at this guys. So, pH 7.22.
Acidic.
Okay, correct. So 0.35 to 0.45, ubos man, so acidic. What about your pakutong 51?
Acidic, sir.
Yes, so 35 to 45, more carbon dioxide, more acid, acidic. Bicarbonate 28,
Basic.
basic. Very good. So 22 to 26, 28 man, taas, basic. So what's the name?
Respiratory acidosis.
That's correct. Yes, that's correct. So respiratory acidosis. Kaya ang problem, ang pareho sa pH ang pakuto. So that's why it's respiratory in nature. So respiratory acidosis. Na ay normal, wala.
No.
Pag nothing is normal,
Wala.
Partially
partially
compensated.
compensated. Very good. So ang name niya, partially compensated respiratory acidosis. That's it, guys. Another one, 7.51.
Basic.
Basic. Very good. Okay, taas man ang pH, that's basic. What about your pakuto 29?
Basic.
Basic. Nga naman, ubos. Ubos ang carbon dioxide nga, acidic in nature, that's basic. What about your bicarbonate?
Normal.
Okay, so this one is 22 to 26, it's normal. Very good. Unsay name man eh?
Respiratory alkalosis.
Okay, correct. So,
Uncompensated.
alright. Yes, very good. So, imong pH, ang pareho niya, pakuto, basic. So, it is respiratory in nature. So, respiratory alkalosis. So, na ay normal? Yes. Ang bicarbonate. It means si kidney, wala ni-respond, katanga ang bungal. So, muna, so katanga siya, uncompensated respiratory alkalosis. So ana siya guys. Next one guys. Kani guys. Unsa man ni guys? pH.
Normal.
Okay. Nakita na normal. Hala. Okay. So normal. Acidic limit or basic limit?
Acid.
Yes. So that is your acid normal. Very good guys. Acid normal guys. What about your pakuto guys?
Basic.
Yes, it's basic. Kay 35 to 45, ubos sa acid, which is acidic. So, ubos sa acid. Ubos sa normal value, which is acidic in nature. Okay, imong carbon dioxide, acidic in nature. Then, ubos siya. So, dili acid, it's basic. What about your bicarbonate?
Acidic.
Acidic. Very good. Kay basic in nature matong bicarbonate and then ubos man siya sa kuan, normal value, so it's acidic. So, unsay pangalan niya?
Metabolic acidosis fully compensated.
Very good. So, ang pareho sa pH, it's bicarbonate. So, metabolic in nature and then acid, metabolic acidosis. Since na-normalize ang pH, naningkamot could see lungs. Naningkamot si lungs na mo compensate and he did a successful job, mission accomplished. Fully compensated metabolic acidosis. So, ana na silang tulog situation guys. Now, let's let the workshop begin. So guys, I have 10 problems here and I need people to participate. Why man? Pag mo participate mo, you have plus points in the exam, the lecture exam. But pag mo correct ka, you get instead of just getting 5 points, you will get 10 points in the lecture exam. So guys, okay guys, kinsa yung participate sa pinakauna guys?
I'll try, sir.
Ella, okay.
Sir.
Sige, sige lang. Sige lang. Paglista mo. Paglista mo. Okay. Paglista mo. Ano na lang guys. Ano guys kung kinsay mga una maka-type sa chat box, so ako, sumuto sila itong pagkasunod-sunod. Sige, type mo ako para magbalon ako kinsay mong participate. Okay. Sige, type lang mo dira. I-check lang ako later guys. Okay, let's start the game. Start the game. Good. Let's start that. Lolo. Okay, right here. Sige, Ella. pH, unsa man?
pH, it's normal.
Very good. Acidic or basic limit?
Normal in basic, sir.
Yes, that's correct. What about your PaCO2?
Base normal. Acidic, sir.
Okay, very good. Okay, more PaCO2, more acid. Okay, it's acidic in nature. What about bicarbonate?
Basic, sir.
Basic. Very good. Unsay name niya?
Fully compensated metabolic alkalosis.
Nganong fully compensated man?
Kay normal ang pH, sir.
Very good. Na-normalize ang pH. Very good. So the answer is fully compensated metabolic alkalosis. Congratulations, Ella. 10 points. Woo! Pakpakin nyo, guys.
Okay, sir.
Okay, very good guys. That was amazing. Next one, si Colleen. Okay, sige. Good, si Colleen. Okay, next one. Okay, so Colleen. Ano ba na itong pH? Okay, correct. So
Base,
this is
sir.
base. What about your PaCO2? Base gapon.
Base.
Kay ubos ang atong kuan, ubos ang normal value, which is acidic in nature. Okay, base. What about your bicarbonate?
Acidic, sir.
Acidic. Very good. What's the name?
Partially compensated respiratory alkalosis.
Perfect. Anong partially compensated man?
Kaya nothing is normal man, sir.
Very good. Nothing is normal. Na problem, na compensation, but it's not enough to normalize the pH. Very good. Perfect. Okay, clap your hands for clean. Go! Very good, guys. Okay, very good. Si Vince. Nice ka, Vince. Okay, next. Okay, na next. Okay, tara, Vince. Okay, ano naman ang pH?
pH, sir, is normal siyang acidic.
Okay, normal.
Then, ang pakutok is...
Okay, Vince. Normal ba siya ang
sir.
acidic?
Ay, dili sir, acid di siya sir, kay 35 to 45 manday, sorry.
Yes. Di man ni
Yes,
ginang
sir.
kwan. Di man ni ginang kwan range, 35
Ay,
to
okay, yes sir,
45.
yes, sorry sir.
Acidic siya.
So,
What about your PCO2?
is kuan sir kanang 47. Kuan na siya sir, asa mo siya? Base sir, base sir. Base sir.
35 to 45. Atong
Ay,
range.
ang iyang kuan di sir, ang iyang taon ay.
Unsa ang nature sa imong carbon dioxide?
Yung nature is acid sir.
So daghan man acid, unsa man? So daghan man carbon dioxide.
Acid di sir.
Okay, so that's it. So acid siya. What about your bicarbonate?
Yes sir. Kuan sir, 22 to 28. So, kuan siya sir, base.
Okay, so base siya.
Normal.
Okay, ang base normal ba siya? 22 to 28 ba tong range?
26 days sir, 26.
26. So 22 to 26. So 28 siya. So base siya. Yes, Vince. Say pa nga to, Vince.
So, ang atong kuan, ito ha.
So ang pareho sa pH, unsa man?
Kuan sir, ang pakuto sir, so meaning na siya, kanang, na siya sa,
Ang
respiratory, kuan,
respiratory.
acidosis, tapos kuan siya sir, nothing is normal, so kuan kanang fully compensated.
Fully ba ang nothing is normal?
Partially compensated.
Partially compensated. So just remember the concept. So just remember the concept. So kani siya kwan. So kani siya Vince. Kani siya Vince, ang problem kay ang lungs. So nay problem atong lungs, ni compensate ato ang kidneys. And then pag atong kidneys nag-effort siya pero it's not enough kaya wala na normalize atong pH. So that's why it is partially compensated respiratory cirrhosis. Don't worry, Vince. Nagabugay 10 points, Vince. Okay, come na pa si Vince. Thank you so much, Vince.
Damay. Sige.
Very good.
Very good. Ay la.
Kisa gusto mo, Vince. Okay, next. Okay, next. Good job, Vince. Wonderful. Ano, Vince? Burak. Next one, Kim Joan. Okay, sige, Kim. Ikaw pala, Kim. Right here. Next one. Lalo. 1, 2, 2, 3, 4. Okay, sige, Kim. So, yun sa man ang pH, Kim.
Okay, so pH is that's acid.
Okay, good.
And then si Pakoto, Pakoto is acid by nature. 25 to 40 plus. That's normal.
Good. So what about your bicarbonate?
Si bicarb, 22 to 26. So basic by nature. So 18 siya. That is acidic.
Good job. What's your name?
Respiratory. Wait. Mali. Metabolic acidosis. Pero and then normal man siya. So wait. Uncompensated metabolic acidosis.
Perfect. Uncompensated metabolic acidosis. Kay since na problema atong kidneys and then si lungs wala nag-respond kay normal ang PCO2, uncompensated. Very good job, Kim. Okay, wonderful. Palakpakin si Kim. Next one, si Krisha. Okay, si Krisha, go. Wait lang ha.
Wala sir.
Ay, kani. Sige, what's your pH?
So pH sir is normal, 7.42.
Okay, what's our range? Is it acidic normal or basic and normal?
Base
normal. Very good. What about your PCO2?
So high siya, so it is acidic sir.
Okay, very good. So what about your PCO3?
And then it's also high, so it is base.
Very good. What's your name now?
So since it has normal, so uncompensated wait lang sir.
Ang normal ang pH.
So normal ang uncompensated metabolic
Uncompensated ba ang normal na pH?
normal no sir, fully compensated metabolic alkalosis.
That's it. Fully compensated metabolic alkalosis. Di man ang imong problem si kidneys. Naningkamot si lungs nga mo compensate. Ang to naabot na normalize ang pH. It means successful si pH, si lungs sa iyang compensation. That's why it is fully compensated. Kaya na normalize man ang pH. So, ana guys, that's the concept, guys. Remember the concept. Okay, good job, Krisha. Now, 10 points. Krisha, palakpakan na to.
Go on, guys.
Good. Very good, very good. Okay, so 5 more to go. Okay. Okay, so next, si Gerard. Okay, Gerard. Okay, ikaw next. Bum. Okay, ka ni Gerard. 7.30.
Cancer. Acid.
Acid. Good. Okay, what about your PCO2?
Acid, sir.
Okay, acid ka po kay daghan. Very good. What about your bicarbonate?
Base. Basic.
Base. Correct. Kay gamay. Okay, kay daghan siya. Daghan bicarbonate, which is basic in nature. So, base. What's your name now?
Partially compensated respiratory acidosis.
Correct. Partially compensated respiratory. Anong partially compensated man?
Walay normal sila, sir.
Walay normal. So, nag-effort, na problema si lungs, nag-effort si kidneys, but it's not enough effort para ma-normalize ang pH. So, partially compensated. Very good. Okay. So, okay. Okay, so Gerard, parapakan si Gerard. Go! Okay, ang next si... Okay, si Alan. Okay, so... Okay, go. Okay. Next, guys. Okay, si kanay, Alan. So, man siya?
Ako na, sir?
Yes, ikaw na.
PH, basic.
Okay, basic, good. What about your PCO2?
Acid.
Okay, so acid. Acid ba?
And, base day, sir, base.
Okay, base. Anong base man?
Kay, taas man siya.
Taas ba siya?
Ay,
Kasi
no.
normal value sa imong PCO2?
Mubo day. 35 to
45.
45.
Yeah. Since 32 man siya, mubo siya.
Yes, sir.
Okay, very good.
Mubo.
Then, ang ato ang PCO2, unsa man itong PCO2? Acidic or basic in nature?
Acidic, sir.
Acidic in nature. Then, ubos man siya, so dili siya acidic. It's basic na siya.
Basic.
Good. So, what about your... Okay, ala na, imong PCO2 acidic in nature. Since ang imong value kay ubos man siya, so di na siya acid karon. It's basic na siya. Right? So, what about your bicarbonate? Unsa man ni? Unsa imong normal value?
Sir.
Ang bicarbonate, unsa man imong normal value?
1, sir.
22 to 26. 6. So, unsa man ang 24?
Normal, sir.
Normal siya. So, unsa may ngalan karon?
No. Respiratory.
Okay.
Respiratory alkalosis.
Alkalosis and compensation.
Respiratory alkalosis. Uncompensated.
Very good. Perfect. Uncompensated respiratory alkalosis. Very good job, Alan Jet. Palakpakan na to.
Thank you, sir. Nalibog ko, sir, na. Kasi lang.
Sugot pa man ta. Pag once na-master ang concepts, balik-balik na ang mga numbers, balo na kayo ka. Okay, very good. Okay, next one. Kasi next. Pag-uma ni Alan.
Jabber, sir.
Okay, very good si Jabber. Okay, good. Okay, very good. Kaya, ano man pH ni Jabber?
Ang pH niya, sir, is basic.
Basic, correct. What about your PCO2?
Ako 2, sir, is acidic.
Yes, that's correct. May taas man siya. Very good. What about your HCO3?
And HCO3 is basic, sir.
Basic. Very good. Kaya daghan man siya. Good job. What's your name now?
Partially compensated metabolic alkalosis.
Perfect. Okay, perfect job, Jabber. Palakpakan si Jabber. Go! Good job. Okay, last two. Kasi sunod ni Jabber. Sunod ni.
Roxanne?
Okay. Sige. Okay, sige. Okay. Sige, Roxanne. Ikaw. ba ni? Mura ba ni? Asa naman ko? Ah, 1, 2, 3, 4, 5, 6, 7, 8. 8 na ba ta? 8 ito 9. 9. Okay, that's it. 9 na 9 na day. Sige, kanino saan sa man siya? Sama pareho lagi ni. Hello? Roxanne, are you there? Hello? Hello there?
Tignan na lang headset at Rox.
Yes, sir.
Okay, sundan na ka? Okay. Sige, sige. What's...
Dunggan ko, sir.
Oh,
Sir,
hello?
madunggan ko.
Oh, dungan na ka. Okay.
Okay, sir. So, pH, sir, is basic.
Okay, good. What about your PCO2?
Then, Pakoto is acidic.
Okay.
Acid.
Okay, good. What about your Kwan? What about your bicarbonate?
Then, bicarbonate is basic.
Basic. What's your name karon?
So, ano siya, sir? Metabolic alkalosis. Then,
Compensation?
compensation.
Nabay normal, wala.
Partially compensated metabolic alkalosis, sir.
Very good. Partially compensated metabolic alkalosis. Prapakasuksan, go! Very good, very good. Okay, I think ang next si Krisha. Sige, Krisha, go.
Yes, sir.
Hmm.
Um,
Sige, ang
pH is acid.
Okay, good.
So, Pakoto is acid.
Okay, good.
And
Kaya ko siya.
bicarbonate is basic.
Basic.
So,
Very good.
partially compensated
Partially concentrated
respiratory acidosis.
Okay, very good. Very good. Partially compensated respiratory acidosis. Very good. Palakpakan si Krisha, go! Woo! Okay, I think si Queen yung sunod. Sige, Queen.
Napaday, sir.
Actually, gibalik na ko isa para nakay mo. Sige, go.
Kuan, sir, yung pH kay normal.
Okay. Unsa nga kuan?
Then yung
Acidic normal or basic normal?
kuan, sir, acidic normal.
Good. What about your Pakoto?
Pakoto, sir, is base.
Okay, so base.
Then
What about your bicarbonate?
acid, sir.
Acid. Very good. Unsa name karon?
Ang names ni kapulol ko. Yes, sir, kay kuan, sir. Kanang isa lang, sir, na ko nahanap pa ka.
Sige. Remember the concept.
Fully compensated respiratory alkalosis.
Alkalosis ba? Tanaw kung pila ka buok kung siya mas daghan.
Ay, wait lang, sir. Pakoto.
Tanaw ang mas daghan. Acid ba ang base ang mas daghan?
Kuan, sir. Partially compensated metabolic.
Tanawa sa dagan sa right. Mas dagan pang acid o mas dagan ang base?
Mas dagan ang
Ang acid. So, ano yung pangalan karon?
Kuan, sir. Partially compensated. Ay, wait lang, sir. Fully compensated, fully compensated,
Aha.
isa lang sir, fully compensated,
Si, correct na imong compensation. Correct na po ang imong metabolic.
metabolic acidosis.
Very good. So, na siya. Fully compensated. Metabolic alkalosis. Happy alkalosis. Actually, guys,
Thank
alkalosis
you,
is sa
sir.
acidosis na siya, guys. Sa kubutangan na. Okay. Palakpakin si Queen. Woo! Go!
Yes, sir.
Okay. Alright, okay. Good job. Save na pangalan guys sa acidosis siya, guys. Okay, and that's it guys. What a wonderful activity. So, everybody, tanang third years, palakpakin yung kaguliyong guys. Palakpakin yung kaguliyong guys. Go! Very good. And we are done. And we are done with my discussion. And here's a quote to live by. The best nurses were not born smart, talented, and skillful. They strive to be the best. Always remember, guys. Nalagi guys ha. As nurses, guys, what we are so good at is perseverance. Kanang nurses nga bright, kanang nurses nga talented, they're not fit to become nurses. Di na sila fit nurses, guys. Tama ko. Sa tong bata-bata pa ko, I'm smart. Wala ko nagdugay sa akong nurse. Nag-teacher ko. Kaya ano man, mas ganahan ko magtudlo. Di ko ganahan mag-nurse. Ang mabuhi sa nursing, guys, kato mga mo persevere, guys. Kaya ano man, nursing in our country, gidaog-daog na kurso, gidaog-daog na professionals. Kung sa man pag-usurweb sa itong mga nurse, we persevere. We become better. So, ana, parita ba daog-daog. That's why, ang nurses, nature, ganato na mo persevere. That's why the best nurses, they're not smart, they're not talented, they're not skillful, they are persevering. They are striving, always striving to be the best. So ana guys, timayan nyo guys, always remember. Okay, and thank you so much for participation and we are done. Sige, on with the program. Okay, we're done guys.
So thank you, sir, for that wonderful second part of the discussion with regards to our webinar, with regards to arterial blood gas and how it is applied, and also how it is tested and determined by using those exercises and tests during the workshop. Now, on this part of the webinar is for our open forum. Questions and queries will now be entertained through raising your hands, or you can just type in your questions in the in-call chat box, and so that we can address your questions. The floor is now open for questions.
Sorry guys. Represent pala ikaw ako bantay. Okay guys, do you have any questions guys? Yes guys. Sige Miguel. Mm. Mm. Oo. Seventy to 100 Miguel. Oo. Oo. Okay. Kana siya actually kwan sa ako naman kung kwan sa ako gid kanang ako ging i-focusan kay ang kwan sa akong i-focusan kanang acid base balance lang siya. But okay, I assure you I will come back to you ana sa atong lecture. Okay na Miguel? I-review sana ko siya. Thank you. Sige. Sige. Other questions?
Sir, I'm Julia, sir. Sir, I wanted to ask, since 7.35 to 7.39 is usually on the acid side, what if in one of the questions you'll be given exactly 7.40, sir?
Oh, kwan.
What should we
Actually
put, sir?
kanang nakasulay mo na sa yung last nga quiz nga kwan na 7.4. Nakasulay na bang kwan na 7.4? Pero what if nga na 7.4? Okay. So actually kwan dili ginato siya ma determine kung unsa siya kay wala man siya sa kuan wala man siya sa lower limit o sa higher limit. And then kuan pod if i-relate gini mo siya sa kuan sa tinuod nga kinabuhi wala gi perfect na normal. So wala gi perfect na normal guys. So dili gina siya mabutog 7.4. Naagi na siya sa upper limit o sa lower limit sa normal. Ana. Tumuro to siya nila. Tumuro to siya. And then sa
yes,
ako
sir.
pong
Thank you,
sa
sir.
ako pong exam sa kuan sa 20 items siya tong RLA. Wala pa ko normal nga ibutang 7.4 gid. So ana. Okay, any other questions? Okay, Queen. Mo Johnny.
Okay, butang.
Oh.
Ah. Sir, sa metabolic acidosis, ito ba metabolic acidosis kay hyperventilate ba to sir, sakto
Ani
ba?
ha. Kana siya nga concept. Kana siya nga concept.
Mm-mm.
Ang kanang kuan kana tong hypervent kana ato ang kay at sa PCO2 ang problema na kanang kuan capacity di ba atong PCO2 kay kuan man it's the capacity of the lungs, it's the capacity of the lungs to exhale carbon dioxide. So ana man yang kuan ana man yang process ana. And then timanan po nato nga ang ato ang PCO2 is acidic in nature. So kung dagan og kanang kuan, dagan og kanang acid atong lawas, dagan og acid atong lawas, it means wala na to ginabuga ang carbon dioxide. Wala na to ginabuga ang carbon dioxide kay daghan sa atong lawas. It means naay problema atong lungs. Probably kuan na kay COPD or kanang naay kanang advance nga lung damage sa imong alveoli or basta na kay problema sa imong lungs. That's why na impair imong capacity nga mo na impair imong capacity nga mo exhale sa imuhang carbon dioxide. That's why nitaas ang pressure kay imuhang kwan lungs naning kamot nga mo mubuga gid siya. Naning kamot nga mubuga ang lungs nga mo mubuga siya sa carbon dioxide kay na-impair man imong lungs. So kana siya nga situation mo na siya atong respiratory acidosis. Respiratory acidosis kay taas ang PaCO2. And then dagag carbon dioxide sa atong lawas. And then pag dagag carbon dioxide sa atong lawas, acidic man ta. And then may problem atong lungs. Then nagliso tagbuga sa carbon dioxide. That's why nag-build up siya sa atong lawas. And then kanay mong gingon nga ng hyperventilate. Sige tagbuga, buga. Nahurot na natong buga ang carbon dioxide. Ang nabilin, gamay na lang carbon dioxide sa atong lawas. Sa sige na buga. So sama na siya nga situation nahimo ng basic atong lawas kasi sige matagbuga. So that is respiratory alkalosis. So mo to siya Joni. So ani Joni ha, pag dagag carbon dioxide sa atong lawas, and then taas ang pakoto, taas ang pressure, naningkamot atong lawas nga mobuga sa carbon dioxide. Kay daghan man nag-build up. So daghan nag-build up carbon dioxide, taas ang carbon dioxide, it means na problem atong lungs. Munang kalisod tag paggawas sa carbon dioxide. And then atong lungs na lang problema pagka nang na-over po siya, niubos ang niubos na ang carbon dioxide sa lawas kasi ginatag buga. Muna siya respiratory alkalosis. And then it's related to your hyperventilation kasi ginamatag buga carbon dioxide then kanang niubos na siya. Do, nagit sa Juni?
Yes, sir.
So muna siya. Okay, anything else?
Excuse me, sir.
Yes, yes, Yvonne.
Sir, kanang abot og relate siya. Ano na nga, an ion gap?
An ion gap?
Ay, ambot, sir.
Ion gap? Okay.
Kuan mo gud mi ana last sem asa na yung assignment wala kasabot.
Sige. Ihatag mo na sa akong assignment. Ako nang siran sa imo. Okay, actually wala po kay idea na. Wala kay idea na ion gap. Okay. I will give that as my assignment and I will explain it to you. Okay? Alright. Any other questions? Okay, that's it. Wala na. Okay. Right, so that's it. And I think I officially closed the Q&A. Okay, let's proceed with the program.
Uh, since there are no more further questions, I guess all our questions and queries are already addressed. And for now, may we call on Ms. Krisha Ann Sulong for the presentation of the certificates.
Okay, so once again, good afternoon, everyone. Gerard, are you going to present? Okay. So, as a token of gratitude, so the Liceo de Cagayan University College of Nursing awards this certificate of appreciation to Christian B. Villan, RN Man, for sharing his knowledge and expertise as a speaker at the webinar entitled Arterial Blood Gas. So, this is given 3rd of March in the year of the Lord 2021. Signed by our academic chairperson, Mrs. Charito G. Harong, MNRN, and our very own OIC Dean, College of Nursing, Mrs. Gloria M. Cunanan, PhD, RN.
Thank you, guys. Thank you.
A round of applause, please.
Thank you, guys.
Again. Now, to formally close the program with regards to our ABG seminar, may we call on Ana Doreen D'Italia to give her closing remarks. A round of applause, please.
So, good day to everyone. On behalf of the webinar committee, I would like to express my gratitude to all of you who have come together and participated in today's activity, for your cooperation, which has enabled us to conduct a highly fruitful and successful webinar. It is my hope that we will be able to make use of the things we have learned from this webinar into the clinical setting in our future face-to-face classes and clinical exposures. Again, I would like to extend my thanks to all the people who made an effort to be here, to my fellow student nurses, and to our speaker, Mr. Christian Villan. It is our honor to have you here to give us further knowledge on what ABG is all about, its sampling and interpretation. And before I end this remark, I want to leave this quote stated by Mark Reed. Student, you do not need to pass the test. You study to prepare for the day when you are the only thing between a patient and the grave. Thank you very much for everyone's cooperation. Have a great day ahead.
Thank you, Ms. Ana Doreen D'Italia, for your wonderful closing remarks. Now, our seminar has come to an end. Once again, my name is Alan Daniel F. Abosejo, your Masters of Ceremony. Together with our distinguished speaker and our core team members behind this webinar, we give you our heartfelt thanks for appreciating and engaging in this activity and webinar. And for additional information, there is an evaluation that will be sent and that needed to be answered. So please check your emails. Once again, thank you.
Very good job, third years. Okay, we're